And so our first speaker that I'd like to introduce is Dr. Beatrice Etemesi. So she is going to be presenting on advocacy for skin health and government services. She's served as a GLODERM mentor for several years now, and she's coming to us from Kenya. So we are delighted to have Dr. Etemesi here. Thank you.
Good morning. Before I start, I'd like to thank the GLODERM team that is headed by Carrie. I thank you for the support that you gave me. Now, I'm going to talk on advocacy for skin health in government services. Now, most of us have different perspectives of what a government is. If I ask that question, people would be wondering, what is a government? So to put us all together, the thing that I'd like to say is government is a system that makes and enforces laws and policies for a country. And one of the government primary roles is providing public services. That is where healthcare comes in. And it is important to know this, that it is a system, because you need to know where you can be able to plug in. Now, we have the advantage of skin being very visible. This is an advantage and a disadvantage. Advantage in the terms that when your skin is visible, people think it's very simple. The reason why they asked me, why did you decide to go and do dermatology? Now, when it is the other thing that is there about the advantage of having it being visible is the fact that when it is visible, you can be able to use that to manipulate and ensure that you can be able to advocate for skin, creating a very good agenda. Now, for me, the main thing that I do to be able to unpack and create an agenda for skin health is to use what the World Health Organization has used in terms of health system strengthening. And based on this, you can be able to create an agenda for you to be able to advocate for skin health. Because this way you are able to talk the language that the decision makers, the policy makers want to hear. We always talk in jungle, and I think the main thing I can say is the way I got lost today coming here, I actually realized that's the thing that us as doctors, medical people, never give the right language to the policy makers to be able to understand what it is that we're advocating for. And it reminded me of this canvas we painted. When you are able to paint it, remember we started with a background. Then we moved on until the details. This is what we are supposed to be able to talk to the policymakers to be able to understand what we are trying to do in terms of advocating for skin health. The background or the main thing in terms of skin health is data. If you don't have data, you'll not be able to communicate properly. Now, when you look at this data, you can see skin is one of the second most common cause of morbidity for those who are above 5 years. Something that people may not be aware. So the first thing we have to make sure is we have data. Now, the dermatologists play a very crucial role in terms of ensuring that skin health is advocated for. Now, we need to know what our mandate is to be able to advocate. And this advocation can be at any level. You don't need to be at national level. Starting from primary all the way to national, we can be able to advocate for it. We need to be very clear. As you are looking at the canvas, if you start drawing those three ladies before you put that background, you mess up the whole picture. So you need to know, you need to be able to communicate it clearly. And it has to be evidence-based, as I've told you about the data. And you need to speak in a language the policy makers will be able to understand. We tend to simply start talking and giving the jargon in medical terms. They will not understand and they will not consider you in terms of advocating for skin health. Know when to introduce the agenda. If you don't introduce it at the right time, you will miss the opportunity. Now, there are different ways in which you can get an opportunity to advocate for skin health. And it can be through being able to to be involved in developing of national guidelines. I had the opportunity of being able to write the section on dermatology. You can be able, when the government is still having issues to understand, you can be able to partner up, as you can see here with Professor Harris. He is the one who we were able to start in a small way to do the leishmaniasis program. And after some time, the county was able to take over. You can also go do it through trainings. Each time they have trainings, make sure you're there to be able to advocate for skin health, so that now it will be a holistic approach to a patient. Now, as I said about the leishmaniasis program, when the county took over, we were able now to be able to do look at children. We were able to screen children to be able to know if they had leishmaniasis or not. And during that time, we were able to see quite a number of other conditions. Because of that program, we were able to, in the Kalaza guideline, we were able to include cutaneous leishmaniasis in that. And because of that, through the albino program, we were fortunate enough now to be involved, because the albino program is the one where we have been able to educate the patients and their guardians to be able to understand more about skin health. Now, the best part I have liked is the albino program. This one was started by patients, and the patients were able to come up with ways in which they wanted their program to run. Based on that, we have been able to have disability cards for persons with albinism, and through that, we have been able to pave our way into the program to be able to include any other person who has a skin condition, and they can be able to be considered to be having disability, and there are things which are supportive for them when they're able to enter into that system. Now, to conclude, the main thing I want us to know is we need to understand the mandate, our mandate in skin health, and relate it to government policies. If we relate it to government policies, we can be able to change policies to agendas and agendas into policies. We need to educate the people. If the people are not educated, they'll not be able to understand what skin health is. And they are the pivot for us to be able to ensure there is skin health. Now, we have said, make sure we change policy to agenda, or we can change the agenda we are seeing into a policy or law. Thank you.